Hi, I'm Dr. Charles Thompson. I'm an interventional cardiologist with Cardiovascular Institute of the South. My primary site of practice is in Zachary, Louisiana. I also have privileges in practice in Baton Rouge as well as some in Lafayette. My primary area of interest is invasive cardiology with treatment of coronary artery disease, peripheral vascular disease, with a lot of interest in syncope, which is the medical term for passing out. So I grew up in a very small town, farming community. Always wanted to be a diesel mechanic or farmer. But that really didn't work out for me because I was called to become a physician. And once I kind of got that calling, that's the direction I went into. So I pursued that all the way through elementary school, high school, college. I spent almost 20 years working as a paramedic for Acadian Ambulance Service in multiple areas, ground ambulances, air ambulances, some supervisory positions until I finally got into medical school. Trained solely here in Louisiana, both at LSU, in Shreveport, and New Orleans for med school as well as internal medicine and cardiology. I love a very personal interaction with my patients. I want to get to know them more than just that they're a chart number with a disease that has this code number. I find out a lot about the patients because it has a bearing on how I approach recommendations for treatment plans for the patients, because different patients have different thought processes and different family lives, and all that has to be taken into account when you make plans for diseases that are going to be with them for the rest of their lives. I really enjoy making an immediate difference in a patient's life. When someone comes in with a heart attack, you treat them, and within just a few minutes, they're pain-free, ready to go home, although you can't send them home. But it's a night and day difference in them. Putting in a pacemaker, kind of the same thing. They're weak, they're tired, you get them a pacemaker, and they feel so much better. It's that instant gratification that I really like about being an interventional cardiologist.